works in a perfect market, perfect competitive market. Yes.
When does it work in business, but not in the role of color?
Right. In other words, if you want to get into this a little bit further, I'll just briefly touch on it. There's something known as public goods, and there's something known as commodities. Commodities are food and cars and toys and whatever else you buy. So what we have right now is the fact that healthcare is being equated in a supply-demand relationship in the same way as what you talk about whether you buy a Cadillac or a Chevrolet or which bicycle or which food. And with those products, there's something known as a substitute. You can substitute those products. In other words, if the price of the one you like goes up too far, you can, when it comes to food, you can always move to something else. So that's where economic theory is working in the healthcare system right now. That's where many of the arguments are based. So I think as a human right, if it's viewed as a human right, it will change that dynamic. The other fundamental question, because what is the role of government? What is the role of the private sector? And for people of faith, who is our neighbor? What is our responsibility to our neighbor? And at this point, let's give you a little break, I think.
Pastor Huff would like to talk to you in his office.
Sit down, Bob.
I'm not happy, Bob. Not happy. Ask me why.
Okay. Why?
Why what? Be specific, Bob.
Why are you unhappy?
Your customers make me unhappy.
What? You've gotten complaints?
Complaints I can handle. What I can't handle is your customers' inexplicable knowledge of InsureCare's inner workings. They're experts. Experts, Bob! Exploiting every loophole, dodging every obstacle. They're penetrating the bureaucracy.
Did I do something illegal?
No.
Are you saying we shouldn't help our customers?
The law requires that I answer no.
We're supposed to help people.
We're supposed to help our people, starting with our stockholders, Bob. Who's helping them out, huh? You know, a company
It's like an enormous clock.
is like an enormous clock. Yes, precisely. It only works if all the little cogs mesh together. Now, a clock needs to be clean, well lubricated, and wound tight. The best cogs have jewel movements, cogs that fit and cooperate by design. I'm being metaphorical, Bob. You know what I mean by cooperative cogs? Look at me when I'm talking to you, Bart.
That man out there. He needs help.
That changes the subject, Bob. We're discussing your
He is
actions.
getting mugged.
Well, let's hope we don't cover
I'll
up.
be right back.
Stop right now, or you're fired. Close the door. Get over here now. I'm not happy, Bob. Not happy.
He got away.
Good thing, too. Huh, you were this close to losing your...
Uh-oh.
You know, I think after looking at that, that's how I felt about 3 o'clock on a Friday afternoon. It's where he got to the point of throwing him through the wall. Another thing that just struck me is one of the issues in America about employment is since many people's health insurance is tied to where they are employed, I've heard a lot of people say, I'd like to quit my job, but I can't because of the benefit. Is somebody that's that unhappy with their job? There are some people that just absolutely hate their job. As a nation, as a company, are they going to be as productive? If you got unhappy people working in the workplace?
The thing when you hit me watching that is, in the scene he's talking about it would be illegal for him to say not to help the customers, but the reality is it's only illegal not to help the stockholders.
Right. Right. So, health insurance, complexity. It's a legal document. It's a long legal document. I was in business for off and on for 20 to 25 years. I had to deal with employer-sponsored health insurance. That's sometimes even more complex than a health insurance policy that you buy for yourself. Many of the terms and conditions are the same. But, yeah, enough said about that. But one of the problems is there's a term we use called asymmetry of information. Now, what does that mean? Have any of you read the fine print on the contract for your credit cards and completely understand everything that it says? How about a mortgage document or any loan document? Have you ever read every page of it and completely understood what it meant? That's what asymmetry of information is. The consumer does not have all the knowledge that the company has. And that also applies to healthcare in general. If you go to a doctor, you're going there for a reason. I mean, we don't know what's going on with our health. Plus, in the healthcare system, you cannot compare prices. You can't call XYZ hospital and say, well, how much is this procedure going to be?
Yeah.
And compare it to ABC. You're basically at the mercy, I'll put it this way, you're at the mercy of the system, and even when you bang your head against the system, like I have with my involvement with my daughter, it is just a monumental task. Again, the goal of the health insurance is maximize value. I think that little clip kind of said it all, along with what we talked about. Examples of complexity. I would say, for me, it's you take Medicare Part D. I think I probably said that here before. You have 4 levels of drugs each year. You get a new formulary. That formulary, that's the drugs for the particular plan that you select. The last time I signed up, there's supposed to be a little calculator that they advertise that you can go on the internet. And all that did is showed me that there was 48 different plans available in this area. You need to go through those 48 plans, and each one of those have a different formulary on which you type in the drug you're taking, and it brings it up, and each one has a different copay, different deductible, different premium. Is that choice? That's complexity. And I'll just say something, again, not a political statement. It's what I know about the Patient Protection and Affordable Care Act. You've heard about the insurance exchanges that each of the states are supposed to set up. Okay, in those exchanges, there's going, as it was originally written, there's going to be 4 different levels of plans. Basically, it's going to be from 60-40. In other words, the insurance company will pay 60%, you owe 40, up to 90-10. So it'll be 60-40, 70-30, 80-20, and 90-10. Now, the prices on those policies are going to be different. It will be means tested, so if you can't afford to buy insurance, it'll be on a sliding scale from 2% to 9% of your income determines what the government will give you in the form of a tax credit to be able to purchase insurance. To my knowledge, however, it does not means test the overall cost of health care. You're still going to have the copay, you're still going to have the deductibles, and from the literature I'm reading, all of that is headed up. Bottom line for the consumer, I like this slide. It's buyer beware.